And to keep going with our heart and health segment, we're with Samuel Benyamin, and he's a licensed physical therapist here at Heart and Health. And one of the things that we wanted to know is the benefits of physical therapy. People talk about it. It used to be years ago that rest was the best thing, rest, rest, rest. And now right now, right, Sam?
Yeah.
Rest is not the best thing for you.
So this is true. I mean, back in the day, in the 70s, 80s, 90s, everyone was taught to do rest, ice, compression, elevation. Now research in the past 10, 15 years has shown that you actually atrophy when you are at a state of rest for too long of a period. So orthopedist doctors, they want you as soon as you can to get out of bed. They want you to start moving. If you have a sports injury, you're not resting it for a week or two. It's usually maybe a day or so, and then they really want you to get up, move, do some kind of a physical activity. And it doesn't have to be running a marathon or anything like that, but just trying to get that joint to move, get the swelling out, start introducing some gentle exercises, range of motion exercises, some strengthening exercises. So that is the biggest research right now that's happening, that we want you to get moving from an injury so that you don't atrophy and lose some of the mobilities that you previously have gained. So,
and one of the things is a lot of people don't understand is that when that joint is filling with fluid, all right, that fluid's supposed to be there for a cushion, but it's not supposed to be sticking around all the time.
No.
Your body is supposed to work that out,
Exactly.
you work that fluid in, the joint heals.
Right.
And instead of just resting where it can be, more and more fluid, where you actually have to get it aspirated, where they have to take a needle in and drain it out.
Exactly. That is an extreme case. But,
Right.
So I would say majority of people, they will fall down, some kind of injury, whether sports related, or a trip and fall, or a car accident, and you get some swelling or bruising. That is your body's natural way of trying to heal it. The issue becomes when you don't get out of that cycle. So therapy helps to kind of get some of that swelling out of there. With our manual therapy techniques that we use here, with our Graston techniques we use here, in our rock tape or kinesio tape, tape we use. So we want to try to get some of the swelling out of there and kind of get you back into a moving state versus a stationary state.
Now, a lot of people think that, physical therapy, so I'm like, you guys are going to have me lifting weights and I'm going to be doing this. Not really understand. You guys actually use sound also, like a sonogram type thing to heal.
that is one of our techniques that we can use. We call them modalities. Besides heat and ice, Graston, we have an ultrasound unit that we use. The ultrasound unit is great to kind of bring some blood flow to the area, which helps with healing. But that is just one of the tools we have. So this physical therapy clinic is very unique in the sense that it's not just for athletes, which we do see, but it's also for the general population. So if you're a deconditioned elderly person and is afraid of falling because winter's coming, we can address that. It's not all about...
You guys do free fall screening.
Free screening for everybody.
For everybody.
At any age, from young kids to...
0 to 90.
0 to 90, yeah. And it's free. It's completely free. You can come in. You just make an appointment and say, hey, I want to do a fall screening. And then we'll go over a few things. We'll work on your balance to see where your deficits are. If you have some weakness in your hips or your knees, we'll address that. We'll do a few tests and a questionnaire. It's brief. It's not that long. It's maybe 10 to 15 minutes.
And it's painless.
It's painless. It's basically your own body weight that we use.
Right.
And then we do a few tests. We'll see how long does it take you to walk 10 feet and back. How many times you can sit and stand. We'll do a little quick gait analysis to see if you're
lean towards the left or the right.
Yeah, or have some mobility issues, and we'll address some of those deficits. And we can make you an exercise program, or even if you want to come in, we take most insurances. We definitely take Medicare, and you can, see what you need, what your deficits are, and if you want to go on program, we're more than happy to help.
And actually, like 5 or 10 minutes now, in the screening
Mhm.
could probably save you a couple of years of some severe pain. Because
Yeah.
as you know, with older people with osteopenia, osteoporosis,
Mhm.
they fall,
Yeah.
it's, even over 50,
Yeah.
you know.
So the most, I read a study recently on PubMed, and it said one of the most telling signs that someone can have a traumatic comorbidity is having a fall and breaking a hip. Once that happens, if you are not a candidate for surgery, you can decondition quickly, and then unfortunately sometimes you end up in a nursing home and you pass. So falls for the elderly are a big issue, and most physicians want to address that so that they don't have complications due to an injury such as like a slip and fall, especially in the winter months coming. When it gets icy out. In the past, I've treated people that have fallen. If they had a little screening, we could have kind of shown them what exercises to do to just strengthen their lower extremity, or if they needed an assistive device like a cane or a walker, at least they would have been a little bit safe outside.
And also, Sam, with the risk assessment, you find out where your weaknesses are.
Exactly.
A lot of people think, well, I walk fine, I'm great, not realizing that as you're getting older, let's say you have a slight twitch, you lead with your left, something. Now as you're getting older, it's going to get worse and worse. It gets magnified as you get older. So by finding this information out early, you can probably negate anything and problems that you would have in the future, right?
Yeah, absolutely. So we'll address what deficits you have, any weaknesses you may have, or a flexibility issue. It could be also a neuromuscular issue, like the signal from your brain is not getting to your muscles, so things aren't contracting correctly. Or you're deconditioned because you've been just hanging out around the house. So when you try to go somewhere and you're not used to it, it presents a problem. Or it can be like something as easy as going up and down the stairs where you haven't done it in a while, and now you're outside and you got to go up a curb, and your muscles aren't used to it. So you kind of misjudge the depth, or you have a issue with like climbing the step, and then you can slip and fall that way. So
and on the assessment, we can find these things out. If you, let's say you have eye trouble or something, or starting to have eye trouble, where your depth perception, like you were saying, going towards steps, or sometimes even walking towards a wall or a door.
Yeah, sure.
All right. To point that out, we can really save this person from a really bad time or a bad injury.
Exactly.
Because especially stairs when you get older, all right, and especially if people have an underlying disease they may not know about, this screening could help them pinpoint it. You might have osteoporosis, you might have arthritis, you might have RA, you could have psoriatic arthritis. These little things would come out in the screening. You'd be able to tell which area of the body is starting, right?
So we look, from my point, we look at the musculoskeletal system. As far as screening for like lupus, that's more of a medical.
Right.
That's screened through some of the physicians we have on board. My scope of practice is to look at your musculoskeletal function to see where your weaknesses lie. So we work mostly on the muscles, joints, and proprioception. That's where we're at.
That's what I'm saying, is that if they go through the assessment and you're finding a weakness, like this person might be having problems on their left side, then you would refer to them if you think that there is something really wrong,
Yeah,
right?
exactly. If we see something else is going on, there's an underlying issue, 100%. So we can call their physician. We also have a physician on staff here, and we're going to have a discussion about, hey, I think something else may be going on, so we should take a look at that. And the physicians here are great. So
you can actually stop it before it starts.
Exactly.
And really.
So preventative medicine is something that we should be practicing. I don't know, for whatever reason, we wait too long, and then something happens, and then now we're scrambling. Versus if we were a little preventative, kind of like maintaining your car. You don't wait till the engine is on fire.
Exactly.
Right? You kind of check the oil, you check the radiator, you take it to a mechanic once a year. You have an annual look at it, right? kind of like an inspection, which is by law you have to do. So it's the same thing. We're kind of just making sure that you don't lead to problems down the road, so we can address it before things come up.
Right, and like you were just saying about the car, but
Mhm.
we think, you know, after doing some studies and talking to people, a lot of people have this fear,
Yeah.
okay? You don't fear taking your car to the shop, well, some people might, but, you know, the thing is, you know, it's your body, and if you're feeling pain or something, that's your body's way of saying, giving you the elbow, right?
Right, that's your like pain is your check engine light. So if you have pain, that means something is going on with your body. So I wouldn't wait too long on pain. It just makes things worse. You know, you need to address that. If you have a toothache, you don't wait years and years. You know, you're going to go to the dentist. You're going to say, hey, I have to see what's going on.
Right.
You may need a filling. You may need a cleaning. So whatever the case is, but a free screening, you can't beat that. You know.
Right.
So I would say,
Especially with medical costs the way they are today.
yeah, exactly. This practice has been amazing to have this service here, and it doesn't cost you anything. You know, insurance, no insurance doesn't really matter. Come in, get screened, we check you out, and it's free. How many times do you hear that in healthcare? Free.
Yeah, when was the last time you got a free checkup for your car, right?
Exactly. Yeah. Exactly.
Yeah.
So.
But, you know, the other aspect of it is the psychological fear that people think that if they go to physical therapy, you're going to hurt them.
Mhm.
Okay, and it's really quite the opposite. I mean, I know people have had knee surgery, it's painful to walk around, so if it's painful, I'll just not do it, not realizing you're going to be doing a lot more damage to yourself as it's going on.
Well, especially post-op patients. If you have your knee or hip or shoulder or laminectomy or any kind of an operation, your orthopedic or your physician will 100% of the time refer you to PT. Why? Because you don't want that operation to fail. So generally what happens after an operation, sometimes your muscles kind of turn off, so, or scar tissue starts to build up.
Right.
So the reason why your orthopedist wants you to go to therapy right away is to get that joint moving and to get your muscles strong. So it can become a big issue if you're not doing that. Now, for the general public, if you haven't had knee or hip or shoulder replacement, but you have general pain, you need to address it. Something is going on.
Right.
Pain is a signal your body's saying, I need help. Don't ignore it. And I hear this story common, I should have came sooner.
Right.
I should have came
Exactly.
sooner. Why did I wait 6 months?
Right.
You know, and sometimes we could save you 6 months of agony. We have a lot of physicians in this country that are amazing, and we should take advantage of them. You know, especially if you have insurance, that's what you're paying. Your premiums.
Right, exactly.
for.
Might as well, you're paying for it, you might as well
You
use
might as
it.
well use it, right.
Right.
So it's a shame when I hear these stories about I waited too long and, you know, now I'm deconditioned, I can't do the
Right.
things that I used to do. But, you know, the thing is, go get your checkup, get your annual checkup, get screened, see what's going on, and talk to your provider.
And the next big one has to be, because like we've talked about falls, we've talked about, you know, this fall and winter. It's much easier to fall in fall and winter.
Yeah.
But repetition, okay, injuries. A lot of people don't understand. The ladies at work on the computer constantly, you know, keyboards, mouse, keyboard, mouse. Next thing you know, they're getting
Carpal tunnel.
their carpal tunnel. This is
Yeah.
getting swollen.
Their joints, yeah.
Should I get it checked out? Oh, maybe I'll be okay. Physical therapy could actually help you before you'd have to end up getting an operation.
Absolutely. So we can teach you some general stretches you can do at work, do a little ergonomic assessment to see how your computer is set up. We can talk about ways to work so that you don't have repetitive stress injury. So we could definitely address that.
The constant sitting, too. That was another one,
That's
right? That was a
another
big
one,
one
yeah.
that we
You know, 80%
found out.
of people in this country have back pain, and it's primarily due to prolonged sitting. You know, we moved away from manufacturing in this country where we were standing and moving and doing things, and majority of us now sit. You know,
Right.
we're sitting, whether it's for fun or for work. It's like majority of our time is spent sitting. So a lot of people start having neck pain, back pain, wrist pain, shoulder pain,
Right.
because they're ergonomically not set up. You know, they're kind of like hunched over and they kind of look like this.
And it could, yeah, it could also happen with the elbows too.
It could also
right?
happen to the elbow, depending
Yeah.
on where you're putting the pressure.
Right.
So I would say, if you're having some of these issues, come in, we'll address them. We'll have a little chat about what's going on, give you a quick screen, give you a few tips, a few tricks, so that when you are working, you have less pain. And you don't, it's a matter of a few corrections, I have a lot of patients that come in and they don't even use their armrests, like that's what it's there for. And they're kind of typing like this and their head is forward. I'm like, well, you have the armrest so that your shoulders can relax, you have the sliding keyboard so your hands can be at rest and your head should be back facing the screen. So
Right.
a lot of people just don't have these like little tips that they need to correct
And
it.
depending where the stress on the body's going,
Mhm.
we could recommend you need to do, after an hour on the computer, get up, do this exercise, because let's say yours is the neck.
Yeah.
The other guy is the back or the shoulder.
Yeah.
So, different strokes for different folks. For, each person, individualized, personalized medicine here. at
Yeah,
Heart
of
and
course, of course. So we do a complete thorough screening. We check you from head to toe and see where your deficits lay, where your weaknesses are, where you lack mobility and flexibility, and we address it. So,
Right.
and I look at the whole body. I just don't like tunnel vision to one
Right.
particular area. Your neck pain could be coming actually from your foot because of the way you're standing, and your shoulders
Right.
are, off kilt, and your headaches can be coming because your neck is too forward,
Right.
or down. Your shoulder pain could be actually your neck pain that's causing your shoulder
Right.
pain, so, or your shoulder pain could be causing your neck pain.
It's all
So,
connected.
It's all connected. So, what's nice about us, we have a thorough 1 hour eval that we give our patients. This is a small clinic, but it's very well diverse in full screening, strengthening, conditioning,
Preventive care.
yeah, preventive care, and I have a lot of training in myofascial release, so I do a
Right.
lot of hands-on work. So I spend about an hour with each patient, one-on-one. And what's nice about this gym, it doesn't get overcrowded. We only see 1 to 2 patients at a time.
Right.
It's very, very mellow and quiet.
Personalized medicine, like you were saying
It's
before, yeah.
personalized medicine, and you won't find this kind of clinic anywhere else. Unfortunately, the way things are going, with some of the corporate America taking over
Yeah.
clinics,
Assembly line medicine.
assembly line
Yeah, that's
medicine,
what
and,
we've always been
and
against that.
the clinics become jam-packed with 4 or
Right.
5 therapists,
Come
with 20
in,
people.
take a number,
Yeah.
see that one. Yeah,
And
it's
half the
just
time,
not-
you're not even seeing the same therapist. It's
Right.
like you're kind of just put through the schedule and you get whoever you get. Here it's just me, I'm running the operations here, so just me and my aide, and we take good care of everyone that comes through. And the word is spreading, so the community is kind of just getting to know us, which is nice. We've been open for a few months now, and it's great. I love the setting. I love outpatient.
And you love what you do, I know that.
And I love what I do. I've been doing it for a very long time, and this is the only thing that I want to do for the rest of my life.
And Sam, some of these younger people, and I say, well, at me right now.
You're still young.
Younger people that say in their 30s.
Yeah.
And they're like, oh, I have this injury and everything, I'll let it slide.
Mhm.
Not realizing 15, 20 years down the road, you are going to have an issue.
Right.
So, and it's like no denying it. It's just going to happen.
Yeah, it's going to happen, and I see this through my years of experience of working with older adults. They say, "Why didn't I address this sooner?" When I was younger, and habits form issues. So if you're having poor body mechanics, if you're having weakness somewhere where it's causing you pain or discomfort, it will manifest itself, and you'll come to have issues down the road. I would say just address it, just like any mechanic. I'm a human mechanic. That's the way I look at it. And
Tune up and oil change.
Yeah, right. So if you go to your mechanic and say, why don't you come in like 6 months ago to address your brakes? Now I got to do everything. You got to do drums, do rotors,
Exactly.
fuel change, like everything you got to do. But if you just had done your brake pads, things would have been easier. So this is the same thing. Don't wait. If you're having issues, go see a therapist, go see your provider. You don't need to be in pain.
And another warning sign, stiffness. A lot of
Right.
people think, oh, I was just, oh, I hit that, oh, you know, this is going, not realizing,
It could be something. Yeah, it could be something. If you wake up in the morning and it's consistent and you're having the same issue night after night, you can't sleep well, there could be an underlying problem going on. And go see your provider. You know?
right, and let's say, you know, you weren't out weightlifting that day or anything, all of a sudden, just the next
Yeah.
day it happens or
Yeah.
something like that with no underlying cause, there's probably reason to get it checked out.
Exactly. You could have had an injury earlier in your life and it manifests later too. The weekend warriors are known for that. You know, they haven't done something in a while and they had an injury years ago when they were a kid, and then you know, after, I don't know,
Gets exasperated.
yeah,
and gets
8
worse
weeks,
over
9 weeks
time.
of doing nothing, and they go out and they try to throw a ball, and then that old rotator cuff injury is nagging them, and now it's nagging them a lot.
Right.
Where when you were younger, you know, it kind of, your body is resilient when you're a little younger,
Right.
it can kind of heal and you get by, and now you're in your late 40s or 50s, and now it's just this annoying, nagging thing. Don't wait. Don't keep taking Advil and Tylenol, and you know, that stuff is not good for your stomach. And don't go the other route with the pain meds, you know, those are no good either. So I would say find yourself a good provider. If you want to come for a free screening, come in, but get checked out. Just
And
like
this is a natural way
this
to
is
heal.
100% natural. PT,
You know,
we're not
there's no
involved.
drugs.
There's no medication. We
Exactly.
believe that your body will heal itself through proper formed exercises, stretching, strengthening, flexibility exercise. Some of the things that we got away from,
Right.
this is the way we kind of reintroduce yourself. Now, PTs can't fix everything. If you're bone on bone, we're going to refer you to an orthopedist.
Right.
So we do have our scope. If you are, you know, having a need for an operation of some sort, you know, that's beyond our scope. So
Right.
that's when we tell you to, hey, you got to go see one of our providers that we have networked with through the past few months. Dr. Swanson is amazing. You know, he's an orthopedist at OLI, which we like a lot. Or if maybe, you know, you need maybe primary care to do a quick screening for your lab work, something like that.
And we have our own podiatrist right here.
We
Dr.
do.
Nancy,
We have
which
a
will be,
podiatry.
interviewing, huh?
We're like this facility is amazing.
One-stop
It's got-
shop.
It's got everything in it. It's like the
Exactly.
Walmart of healthcare. We got, what do we got? We got allergy, podiatry, internal medicine, endocrinology, cardiology, which is amazing. And this is the latest addition to the team, physical therapy, which everyone that's been coming through the door has been like, oh, I can't believe you have it, fantastic. And so we were becoming popular quickly, which is nice. I would say if you need us, you know, please come in, contact us. You can't miss the building, 3650 Route 112 in Coram.
And you could also find out about, like, some people that come in here, they're starting to get overweight. And that is putting
Yeah.
tension and pressure on the bone, the tendon, and everything like that.
Yeah.
So there's certain recommended exercises, things that you could do,
Yeah.
and, you know, nutritionists, I've seen the other doctor, you know, to get it dipped in the bud now
Yeah.
before it really swells into something.
You know, obesity has become an epidemic in this country, and I've seen a lot of people having knee replacements because they're 50, 60 pounds overweight. So one of the things that has to do with that is our lack of activity throughout the day.
Right.
So as we're becoming more and more sedentary because our jobs are requiring us to sit more, or you know, we have screens everywhere, your iPads, your telephones. We're becoming more and more sedentary, and we're eating poor and poor nutritional foods,
Right,
which is
so it's coming home from work,
yeah.
sitting down with the bowl of potato chips in front of the TV for a couple hours, then having dinner,
Yeah.
and then lather, rinse, repeat. This
Yeah,
is the same
exactly.
thing.
So there's no physical activity in some people's routines, and that has caused actually a lot of medical healthcare issues. You know, not just
Sedimentary lifestyle.
yeah,
call it,
it's
right?
causing cardiovascular issues. It's causing arthritic issues. It's a host of problems you're having. But if you think about it, when we were kids in school, we got recess. There's a reason why we got that, right?
Right.
Physical activity. Gym was a requirement to graduate high school.
Right.
In this state, New York State, you had to pass gym. There's a reason for that. If you go to jail, you get yard time an hour every day. And that is not happening with us anymore at the places where we work. We're just sitting and not moving. A tip that I give some people is bring in a jug of water with you. because that forces you to get up and use the restroom. So that is one tip I give people that say, well, I don't have time to get up. Well,
Right.
if you're drinking that water, you're going to need time because you don't want to have a puddle near your desk.
Right.
So obesity is definitely an issue that's causing a lot of problems. We can also address that. We have, every equipment you need for to do some weight loss. But also strength training has shown that it also burns more calories than anything else. So we can teach you also how to do some strength training as well as cardiovascular training.
Right, and all these beautiful, wonderful instruments that you have around you, they're not just for one thing. These are to cover all
No, they do
different-
multiple different things. So
Right.
Our equipment here is not just for one specific. Like I said, we address the whole body, head
Right.
to toe. So we're working on musculoskeletal systems. We're not
Right.
just working on just one particular joint. So we want to move the whole body and get the whole body moving and find where the deficits are and help you to correct them. And then you can go on with your life, healthy and live to 100. Without having to take 15 different kinds of meds throughout your day.
Well, Sam, I want to thank you for this interview and letting us know about what's going on at Heart and Health Physical Therapy. And we hope to see you soon.
Oh,
Maybe
definitely.
bring you back. How's that?
Definitely, sounds good to me. Appreciate it.
Okay, we'll be
Thank you.
back with our next segment in just a second.